For starters, let's classify what a personality disorder is. A personality disorder is a deeply ingrained and maladaptive pattern of behavior of a specified kind, typically manifested by the time one reaches adolescence and causing long-term difficulties in personal relationships or in functioning in society. However, there is a disorder called antisocial personality disorder, which is a pattern of disregard for and violation of the rights of others. Antisocial personality disorder is also referred to as psychopathy and sociopathy. So how is this disorder diagnosed? An individual is diagnosed when 3 or more of the DSM diagnostic criteria is seen. For example, failing to conform to social norms with respect to lawful behaviors as indicated by repeatedly performing acts that are grounds for arrest. Lack of remorse as indicated by being indifferent to a rationalizing, having hurt, mistreated, or stolen from another. And impulsivity or failure to plan ahead. Antisocial personality disorder also classifies the individual as showing no remorse and aggression to people and animals as well, and destruction of property and deceitfulness or theft. A diagnostic of antisocial personality disorder is typically based on a psychological evaluation that explores thoughts, feelings, relationships, behavior patterns, and family history, personal and medical history, and symptoms listed in the Diagnostic Statistical Manual of Mental Disorders, such as or known as the DSM. According to the DSMR, for this diagnosis to be given, the individual must be at least 18 years old and have shown previous history of the symptoms that are of antisocial personality disorder before the age of 15 years old. Okay. Psychopaths are usually manipulative, are champion liars, and can be quite glib and disarmingly charming. They don't fear consequences the way most people do, and while they may react to the stress of being caught in a lie or violent act like anyone would, some remain as cool as cucumbers. Even the most dangerous can appear jovial, carefree, and social at times, but sooner or later they will display a telling distance, a quiet cold-heartedness, and disregard for others. They are often impulsive, yet lack guilt and remorse, meaning they may invite you to join them on a reckless, even dangerous fun, and then shrug their shoulders if someone gets hurt. Although we are not able to diagnose somebody with antisocial personality disorder before they are 18, people or individuals with antisocial personality disorder show symptoms before the age of 15, such as aggression towards people and animals, destruction of property, deceitfulness, theft, and a series of antisocial personality disorder. Although it is not known, something may trigger these emotions or may trigger the disorder, or it is also brought on by certain genes. As mentioned before, we are not aware of antisocial personality disorder's roots, but there are certain factors that seem to increase the risk of having antisocial personality disorder, such as childhood conduct disorder, a family history of antisocial personality disorder, or other personality disorders or mental illnesses, and as well as an unstable or violent catatonic or chaotic family life during childhood. The person with antisocial personality disorder may be able to grow up in a family and have a regular life or a normal life. There may be some complications along with that life, such as spouse abuse or childhood abuse or neglect, alcohol or substance abuse, and individuals with antisocial personality disorder, a lot of drug and alcohol abuse or substances are seen in those victims, homicidal or suicidal behaviors, and low social and economic status and homelessness, and also gang participation. In terms of prevention, there is no way to prevent this disorder. Like I said before, you can trigger this disorder, but there's no ways to prevent it if it is meant to happen, or if you're meant to have this disorder. This disorder is untreatable. This person cannot be given medicine to fix it. It is their personality, and their brain is also not set up the same way that a person who doesn't have this disorder is set up.
When looking at PET scans of people with antisocial personality disorder or of psychopaths, they show a loss of activity that extends from the orbital cortex into the ventral prefrontal cortex and into a part of the prefrontal cortex called the anterior cingulate. The loss of then continues along the cingulate into the back of the brain as a thin strip, then loops down into the lower part of the temporal lobe, into the very tip of the temporal lobe, and the amygdala. All of these areas make up a major chunk of the brain called the limbic or emotional cortex, which is the main area regulating emotion. This added factor may play the biggest role as to why people with this disorder act the way they do.
In relation to James Fallon, he mentioned that a person with antisocial personality disorder may come off as a normal person. They are also going to act normal around you. That you're not going to think that anything is off-putting about them. So there's really no way to diagnose somebody with antisocial personality disorder who is not showing the symptoms, because they will come off as a normal person. In relation to the treatment for this disorder, some people may seek therapy known as psychotherapy or talk therapy. However, psychotherapy is not always effective in these instances. As mentioned before, people with this disorder also has problems with drug abuse or alcohol abuse, so medication is also not prescribed because there may be a misuse. Who has a family member or a friend with antisocial personality disorder, there are many ways of coping and supporting for the person who has antisocial personality disorder. A mental health professional will also give you many strategies that you will be able to use to cope with. Although antisocial personality disorder may seem like it is a scary thing, not everyone with this disorder is crazy and will go on a murderous hunt.